Hi everyone, my name is Kaylee, and today I'm going to be talking about the virus COVID-19, or also known as the coronavirus. This virus started in 2019 and continued to spread all over the world, making it a global pandemic by 2020. This virus is called Severe Acute Respiratory Syndrome, coronavirus 2, or more commonly it is known as the SARS-CoV-2. COVID-19 is mainly transmitted through close contact, especially when an infected person releases respiratory droplets or small airborne particles while breathing, talking, coughing, or sneezing. These droplets can reach another person's mouth, nose, or eyes. The virus can also spread through touching contaminated surfaces, but this is considered less common than droplet or airborne transmission. Schools all over the world were shut down to help slow down the spread of the virus and to make sure people were staying home when they were sick. Here is an infographic about how to stay healthy during the COVID outbreak. It says to wash your hands, don't touch your face, clean and disinfect as many surfaces as you can, cover your coughs and sneezes to reduce droplets spreading everywhere, and avoid contact with others if they may be sick. If you were to be exposed to someone with the virus, a person may experience various symptoms. However, it is also possible to have the virus without showing any symptoms. And then here is a page with all of the symptoms. They include fever or chills, cough, shortness of breath, difficulty breathing, fatigue, muscle or body aches, headaches, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Most people who recover from the virus experience the symptoms many weeks later. This is referred to as long COVID. I know a lot of people that still can't taste or smell as well, so that is known as the long COVID. The best way to avoid getting the virus is to wear a face mask if you know the people around you might be sick. Social distance yourself from others as best as you can. Wash your hands frequently and do not touch your face throughout the day to reduce the spread. A lot of people don't realize how much they touch their face in a day, and I think this makes a huge difference with being aware that you're touching a lot of things and then putting it on your mouth or your nose, and that's how the droplets spread. Another prevention method is to be vaccinated. Since the pandemic, they have came out with a couple forms of vaccines because of all the different strands. The vaccine builds immunity to the virus, so if you do get in the future, your body can react a lot quicker than if you did not receive the vaccine. It also slows down the spread of the virus within people because fewer individuals will become infected and are able to pass it on. And then here is a list of the names of the vaccines we have currently. It shows you on the left column which companies make which kind of vaccines and the countries. And then in the middle column, it shows you how many doses you need. And then on the right, it shows you the temperature that you need to store the vaccines at. Thanks for listening.